Bonnie Kwok, a second-year medical student at UW School of Medicine and Public Health and a constituent. I'm here to urge you to support the legalization of medical marijuana, AB 554 and SB 368. Oftentimes we ask our patients, on a pain scale of 1 to 10, 10 being the worst pain you've ever felt, how would you rate your pain? Let's say a patient with cancer responds that his pain is 15 out of 10. Imagine how that feels. The patient goes on chemotherapy and he can't eat or stop vomiting. Imagine how that would affect your quality of life. Study after study shows that marijuana can significantly relieve his pain and nausea safely and effectively. Canada, Spain, the Netherlands, Austria, and 17 other U.S. states have laws in place for medical marijuana. Wisconsin needs to follow suit. Out of a Canadian study with over 4,600 patients, most of the effects from cannabis were not serious. And the common side effect was dizziness at a low 16%. These findings support the conclusions of the Institute of Medicine that short-term use of cannabinoids for medical purposes is safe. Opponents of legalizing medical marijuana are concerned about addiction. However, Dr. Lester Grinspoon, a Harvard psychiatrist, wrote that experts who rate the dependence of drugs ranked marijuana at the bottom of the list. In terms of addiction, nicotine and alcohol, as my colleague had mentioned, are more addictive than marijuana. Some doctors say caffeine is more addictive than marijuana. The FDA reports over 63,000 deaths from FDA-approved drugs each year. The CDC reports that more deaths are caused each year by tobacco than used by all of deaths from HIV, illegal drug use, alcohol use, motor vehicle injuries, suicides, and murders combined. Deaths from marijuana overdose, 0. So why is it that nicotine and alcohol are legalized recreational drugs, whereas marijuana, an effective, safe drug, cannot be prescribed for medical purposes from a trained health professional when it has proven therapeutic effects? Some opponents advocate for Marinol, an FDA-approved synthetic pure form of THC, an active ingredient in marijuana. Ironically, Marinol, it can be more toxic than in the natural plant form due to its potency, and is the most psychoactive of all the cannabinoids, and that's the one drug that the federal government allows to be prescribed. So as you watch your neighbor of 15 years suffer from AIDS, or your 6-year-old son suffer from cancer, or your grandmother with chronic debilitating pain, will you say to them, I'm sorry, the doctor cannot give you marijuana because it's not FDA approved? No, because the body of evidence is there. We cannot deny people access to marijuana, a treatment that works, nor can we criminalize them for possession of marijuana. While I recognize that this issue extends beyond medicine into the blurry lines of cultural, social, economic, and political boundaries, I have to uphold my duties as a future physician and in a support of a treatment that I believe that works. Thank you for your time and your support of AB 554 and SB 368. Thank you. Thank you.
One of the points you brought up was the pain and nausea from chemotherapy. Isn't it true that the analgesic effects of marijuana are suspect at best, and that there's other remedies that can be used to help with nausea? And my daughter just had surgery yesterday and had to have anesthesia, and they gave her anti-nausea medication, and it wasn't marijuana. So I think those arguments are weak as far as advocating when there's other alternatives that are currently FDA approved.
Well, before I answer the question, I'd just like to ask how your daughter is doing.
She's doing very well, thank you.
Good. And it's, of course, she can't receive marijuana because it's not FDA approved to be prescribed. But there are other anti-nausea medications that work better than marijuana. However, marijuana has been shown in certain studies